Hey Transformers, it's Dr. Angela and this is Janelle, your lovely expert registered dietitian. Nicole is actually going to join us in a little bit. She's finishing up with a training session with one of our patients. So welcome to day 2. I hope you guys had fun with the water challenge. So Janelle, how much water did you drink yesterday?
I drank, let's see, 32 times 3 or 4, so over 90 fluid
I guess
ounces.
if you have to actually calculate how much water you drink, then that's probably a good thing. I probably said 16 ounces. If you ask me, I probably drank, I forgot my MedFit water bottle, but I actually did pretty good. I think I hit like 60 ounces, which is a lot for me. But if you are fit and running half marathons and training for marathons, then you might want to push it to 900 to 100. Hey Corby, thanks for joining us. I'm so glad that you're here. So make sure you pop in any questions while we're here so we can help you bust your bloating. So I just want to do a quick recap of yesterday, the causes of bloating. So that's really the #1 step to get rid of bloating. You actually have to know what the cause is, because if you are trying to treat one thing but that's not really the cause, it's not going to go away. So #1, what we talked about, dehydration. You're just not drinking enough water. We recommend at least 64 ounces and beyond. For those of you who are taller, I would say at least, 5'6". And hi Kathy, thank you for joining us. We're just talking about water intake. So if you're 5'6", you probably need to push it more to the 70 ounces, 80 ounces. If you're a man, more like 90 to 100 ounces. So you guys are just like awesome. And thank you so much for posting the water bottle pictures in the Facebook group. That's awesome. So I would say that's probably the #1 top cause of bloating, is just like not drinking enough water. #2, which is the whole bacterial imbalance in your gut. Now we're actually going to talk about that more in depth tomorrow, so make sure you catch that, because this is giving you the real science of bacteria in your gut. What do you need to do about it? What are the differences between probiotics that you buy from the grocery store versus like Whole Foods or whatnot? Nicole has done a lot of research on it. It's going to give you a lot of good inside stuff. The next is too much sodium and too much sugar. We're going to talk a lot about that today. If you drink or eat a lot of like salty foods, if you tend to be a culprit, which is why we have like food babies when we eat pasta, right? You just feel like you are about to be like 9 months pregnant sometimes, right, when you eat food. I certainly felt that. The processed foods are going to be a big cause for the bloating. So let's just hey Nicole, come on in. We from someone stole your chair. Here you go. So thanks for joining us. So we literally just are recapping the causes of bloating. So not drinking enough water. We talked about the bacterial imbalances. We talked about foods high in sodium and sugar substitutes, which is what we're going to talk about today. But before we talk about that, a few other things. Remember, eating too quickly. I don't know if you were watching American Idol. I feel like Gabby sort of just, got the ringer because the other two were dating, and I think that's why Maddie won. But when you're eating and watching American Idol, all of a sudden you're eating more than you actually need, and you're eating too quickly. And so while I was fired up when I saw that she was like 3rd runner up, it just like makes you anxious. And then I popped over to Miss USA and saw all the skinny little people who I feel like are awesome, but probably eat lettuce all day long to look really good, and then it made me feel bad about my dinner. So but anyways, eating too quickly or eating large portions. And then raw vegetables. What I learned, I'm a cauliflower queen. Please give me another heart if you like cauliflower. But unfortunately the raw kind really gives you a lot of bloating, but the steamed and the cooked also give you a little bit of bloating. And then finally, last but not least, food intolerances. Kathy, you popped in a great question. There is a lot of inflammation in your gut, and you can develop certain illnesses. Your immune system can be down, and like I said, so make sure to pop in tomorrow, where Nicole is going to really give you the true backed up science research of what you need to do to get your gut healthy, reduce inflammation, which will not only just help your gut, but it'll help your joint system, it will help your mood, it will help overall your body. So needless to say, let's begin, because I'm actually really excited about day number 2. This is actually something that I requested Nicole, because I'll admit to you, so here's my story. I'm guilty, first of all. I got up this morning. Haley is like excited. She thinks that today is her last day of school, but I had to tell her it was only Tuesday. And so while I was trying to get her dressed, I got her dressed for school, and she said, Mommy, I want to take a shower. So rather than fighting her, I picked her up and ran upstairs and put her in the shower. This is like 10 minutes before we have to leave. And so I packed up her lunch, which is not the prettiest, and then I'm out the door. I get her to school on time, but guess what happens to me? I get into work and I say, Janelle, I have no idea what I'm going to eat for lunch. And she said, what do you have planned? And I said, chicken broth, which is the only thing in my pantry right now. So she gave me a nice little tip to get some tuna in cucumbers. So we're going to start about this. I said, well, I don't know, processed foods just means anything in a package, but I think that is a misnorm or a misconception, is because not all processed foods are bad. So we're here to teach you how to tell what is good and what's not so good. So this is what I bought today, you guys. I thought this was actually a normal portion. I was told that this is actually 3 servings, when it's actually, I thought it was just 1. So I did eat all of it with cucumber, and now I don't know if I have room for the rest of the day for any more food. And then this one Nicole brought in, but she happens to be pregnant, and this one is actually what, 9 ounces? So we decided this is 6 ounces and this is 9 ounces. So first question, what is a normal 1 serving ounce that is like reasonable for me to eat?
A normal 1 serving would be about 3 ounces. Okay,
so probably what, half of this package?
About half of that.
And then
about 3 in the can.
A third of this can. So let's talk about processed foods. Nicole, explain to us what the heck does processed foods really mean?
Processed really just means anything that's altered from its original state to be made ready, available to eat. So technically, there are varying different levels of processing, and so even like pre-cut vegetables are considered processed a little bit. Even, bagged spinach, things like that. But then most people think of like junk food, like chips and candy and, all the frozen foods, and you go in the frozen food aisle and like ice cream and stuff as being processed, and they are. But it's also having to do your homework and look at the label to see what's actually in that product. Because honestly, most foods are processed, because not all foods, we're not out in the garden, picking up, vegetables, because that would be its like raw form, right, in its original state, in which we picked it. And so that's where you really have to look at the labels.
Okay, so Janelle actually finished her very first half marathon at the Colfax Marathon, ran it under 2 hours. Awesome. So that's why I asked Janelle, what should I eat? So tell me, when I asked you what should I eat, what did you feel were the benefits of tuna and cucumbers is what you suggested for me for lunch today?
So the reason that I suggested the tuna and cucumbers is because it's quick and easy. So Dr. Tran, like she mentioned before, very guilty of not getting her protein in. So, it's a lot easier to if you have the time, it's awesome if you meal prepped on Sunday. You baked your grilled fish or chicken that you can pack. Dr. Tran didn't have time. She needed something quick, something fast. So I recommended canned tuna in water. I didn't recommend the 6 ounces.
The package.
But it's
so we had an argument about this, okay? So this is a marketing, Stephen, this is for you. Marketing. This looks like a grab and go for the busy professional, yes? Because guess what? A busy professional doesn't have a can opener. So that's a tip for you guys who like marketing. They totally got me on this. But then I realized that this is actually the bigger size. Apparently there's a smaller size that I wasn't aware about.
And that's where you have to look at the labels.
Yes. So speaking of that, so Nicole, let's talk about the labels. So let's start with sodium. I know, and we all know that we're not supposed to eat too much sodium, but when you put it to a number, I admit to you, I don't know how much is too high. So what'd you comment on the sodium level?
So what was the sodium in that one?
So the sodium for this is 180 milligrams. But, I mean, it really kind of depends on where you're getting sodium for the rest of the day. You're not getting sodium in cucumbers, depending on if you're having, you know, frozen vegetables that don't have a sauce. It's pretty low. Plus, you can always rinse your tuna or anything that comes in a can to get rid of the excess sodium.
Oh, that's a good idea. You know, I didn't even think about that, too. Even though this tuna is in water, I didn't even think to rinse it even more.
Same with like canned beans.
That's a great idea.
So like all canned foods, right, have a lot of sodium in them. And your max for the day, your upper tolerable limit for the day is 2,300 milligrams, and that's 1 teaspoon of table salt. So that's like a good visual. That's not a lot if you think about it, but you could do the same thing with that kind of stuff and just rinse it and kind of get rid of some of the sodium in there.
Now, I'll give you a little bit of honest truth. I'm guilty. I needed a little bit of a taste because the tuna is a little bland, so I did add a dash of soy sauce. I know that's probably not the greatest, but it's definitely not Whole30 friendly, but I used the light Kikkoman soy sauce.
So that's where you would look for reduced sodium, low in sodium, or no salt added kind of a thing on the label. So that would be on the front of the package.
Now that's interesting that this sodium says 180 milligrams, and this package here actually is 240 milligrams, but this one has more. I think it's because probably the light, right?
It's the light. Yeah.
So I got the regular.
This is no.
Actually, this is junk light. You guys, this is like
this is labels.
I tell you, this is what this country has come to. It's like this. I feel robbed of my nutrition. So that's why we're talking about this, because you guys literally, hi Janet, thanks for joining us. You really want to take a look at the labels. Kathy asked, what about Mrs. Dashford seasoning? Is that okay?
So that is actually okay unless you have any renal or kidney problems, just because it has a potassium replacement, but otherwise it has no sodium in it whatsoever.
Okay, that's good to know. So, okay, so let's pop on to like the sugar side. Nicole, tell us about sugar. What do we need to be looking on the label? What about what is sugar substitutes okay? What do you think about that?
So, things to look for on the label, right? Just to get a broad view of it, is the sodium and the salt, sodium and the sugar. Underneath the sugar, it's going to have, if it has what's called a sugar alcohol in it, it will have the sugar alcohol on it as well. But the sugar is something that you also want to pay attention to, because it's also going to contribute to a little bit of bloat, because we have this hormone called insulin, right? And insulin likes to attract, kind of in a way, sodium. So you're going to kind of hold on to it if you're having too much sugar in your diet, but you want to look for anything that's kind of like Dr. Tran's rule, which is an awesome rule and easy to remember, is a single-digit sugar in anything that you're, package. Like, for instance, tuna's probably not going to have any in it. Let's see.
That's awesome.
Actually,
you don't even have it on the label.
The thing too about this tuna, just so you guys know, you look at canned tuna and you think, oh, it's high in sodium. A low sodium product has 140 milligrams per serving. This only has 180 per serving.
Okay.
So, yeah.
And how much should we have in a day total if we were calculating the whole day?
So your upper limit, or your maximum safe limit, is 2,300. That's that 1 teaspoon of table salt. I always kind of like to go with like that 1,500 milligrams just for like an added cardiovascular benefit. But you can kind of play around with that. Not every day is going to be the same. So like an appropriate meal could be anywhere if you like divided it by, let's say we're eating 5 meals a day. 5 meals or 3 meals and 2 snacks, 300 to 500 milligrams per. So considering, like Janelle said, that's actually pretty low in sodium.
Yeah. So if you had 2 servings of this plus your cucumbers, which don't have anything, not, high in carbs. So again, you're not going to be storing water. we know that carbs like to be stored with water. That's why water weight goes up. You're fitting into that kind of range that Nicole just gave to us.
That's great. And just another thing, for those who do deal with like blood pressure issues or kidney issues, or just you just really want to kind of stay away from salt, think about all the different spices that don't have salt. And so like cayenne pepper or lemon, basil. So if if you feel nervous about using Mrs. Dash, then just kind of look at all of the other different spices, and believe it or not, it can really bring out the flavor without suffering from sort of the downsides of having salt. So, but both salt and sugar, and Nicole mentioned sugar alcohols. It's not in everybody, but I do have problems when I try to eat the Atkins bars. Now, these are labeled as low carb, but what happens is that they substitute with sugar alcohol, such as erythritol, and that's also, I think, in like sorbitol. That's in like sugar-free gum, and sugar-free gum. You had no idea why you're bloating. You could have been like chewing on gum and causing that. So you really need to look at beyond the label and look at the ingredient side. That's usually kind of where all the hidden stuff that is getting in the way. So last question to kind of wrap up the session. For those of you who are mothers, I tell you, I can get Haley dressed, I can shower her, and I can like put her in the car. What stresses me out, believe it or not, is her lunch. I have no idea what to make because, like I said, processed foods, I feel like if I give her anything that's out of a bag or a can, then I'm like, ooh, I'm that mom, type of thing. So I swear she's been eating strawberries every day since August 15th and carrots. And so if you want to make some comments on what kind of things can you give your kids that, do we need, as far as like the processed food concept, what do you suggest?
Well, a lot of times, we were talking about this yesterday, a lot of times kids find textures with proteins to be a little bit difficult. So a lot of the chewing as well that they don't really care for, and so that's a lot of times that's why they kind of veer away from it a little bit. So like some of the softer proteins, you can kind of like get away with making them a fruit smoothie with like some soy in it, so like tofu and cottage cheese and things like that in it, or milk. Greek yogurt, non-fat Greek yogurt is always really good. You can make it really cute, like in a parfait, make it look like a dessert, and go that way and put some strawberries on top of it. Even like making your own chicken tenders if you wanted to do that, because kids don't need as much protein as we do in a day. They probably only need, like your Haley, probably about 13 to 30 grams a day, which isn't too much considering 3 ounces of chicken is going to have about 20 to 30 grams. And so you could like bread it on your own with kind of like better breading.
So another recommendation I have, actually, so again, this goes back to processed food, you guys. Kids love a good PBJ, right?
Yes.
So the best way to make a PBJ, you want a natural peanut butter, okay? Because the only ingredient is going to be roasted peanuts. There's not any of the oil. It's going to be low sugar. Instead of jelly or jam, what you do is you can get frozen berries or fresh berries, mash it up for that natural sweetness, like raspberry or blackberry, and you have your own homemade jelly.
That sounds good.
And then you just... who didn't love PBJ as a kid?
That's my favorite.
Yes.
Yeah, I did.
So
it is. It's that smooth texture, kind of like
in the bread.
Yeah,
too.
Nicole was talking about.
So what would you use instead of bread as a considered like healthy substitute for kids specifically? Could you use like a pita bread?
I personally would just go with like a whole grain bread. That's like, I like Dave's Killer bread, like the thin sliced.
Okay.
Because it's a little bit lower in carbs and much higher in fiber. It has a lot of fiber in it, and just like cut it in half, because kids really only need half of what you would eat.
Gotcha.
And go with that. That's what I would do.
Yeah, and another thing too is just be sure that if you're going to make like a wrap with like a low sodium deli turkey, you only want to use a corn tortilla, because even those whole wheat ones have the vegetable oil in it. A lot of people are under this misconception that wraps are healthier than sandwiches,
Right,
and
right.
that's not actually the case. So like she was saying, doing like a whole grain sandwich, then Ezekiel bread has whole grains in it, a slice of that, definitely, like I said, better options than some of the other things that you would find.
Awesome. Well, good. Well, gosh, I actually learned a lot today. I hope you guys did too. Do me a favor, find a product and take a snapshot of the nutrition label and post it in the Facebook group so that we can all figure out, oh my gosh, what are they trying to sell us here? You know, it looks like a nice package, but when you actually look a little bit closer. But honestly, I feel really good about my tuna and cucumber as opposed to the chicken broth that I had planned, and I would have been hungry, and I probably would have tried to like scramble for, you know, something, yeah, which is not so good. So, but anyways, I'm hopefully you guys got a lot of information. Hey, Justin, thanks for watching us. You're catching us at the ending here, so make sure you go back and catch this video tomorrow. Don't forget, we are going to talk about bacterial imbalances. It's going to be really important because, like I said, this controls your mood, it controls your immunity, it controls your gut system. We're here to potentially explore the whole hypothesis or theory that your gut is actually your primary brain. So Kathy says, rule of thumb, 3 ounces of protein a meal. Is that about right? So, yep, Kathy, you got it. So that's perfect. That's perfect for you. So, but we will post later in the Facebook group when we're going to go live again tomorrow. But, you know, share with us what you got here. Hey, Sonia, aren't you here in the office? I thought you were.
Are you driving?
You rock here. So she's like doing double time. So don't forget to post some pictures of nutrition labels. Share all of your education with us in the Facebook group, and catch tomorrow's live Facebook on bacterial imbalances. And we'll see you tomorrow.